Hello, everyone. Happy Friday. This is going to be a special episode of Facebook Live today. March 12th is a remarkable day in Mobile County with regard to the COVID-19 pandemic. This is the last day of our first year dealing with COVID-19. So the first case of COVID-19 was reported in Alabama on March 13th, 2020. That was a Friday. March 13th falls on a Saturday this year. It's tomorrow. So this is officially the last day of our first year of dealing with the COVID-19 pandemic in Alabama. Our first case was reported in Alabama the 13th. The first case in Mobile County resident was the 19th. And then our first confirmed COVID-19 death was reported on March 27th. So it's remarkable in another way because it's been just 1 year since we began, seeing cases of COVID-19 in Alabama. And in just 365 days, we have logged 502,711 cases of COVID-19 and 10,299 deaths with COVID-19. And these are unfortunate Alabamians that have lost their lives, more than 500,000 people who have dealt with COVID disease, and many families, workplaces, congregations affected by this historic pandemic of COVID-19. In Mobile County today, we're reporting an increase of 31 cases yesterday, bringing our cumulative number for 1 year to 36,729. 3 deaths were reported yesterday, bringing our total of died with COVID in Mobile residents to 754. The cumulative number hospitalized went down slightly. It's at 4,728. Hospitals, they sometimes change numbers in arrears, and it makes that number look a little bit funky, but it should straighten itself out. And then the number of people hospitalized yesterday with COVID-19 was just 45 people, and this is really, really good news. That number was down 9 from the day before, so less than 50 people hospitalized on any given day with COVID. On average, 50 or less cases reported to us each day. And again, just amazing to think about where we have come in 1 year. Mark was reminding me that on March 17th, we began doing daily Facebook Live updates, and in response to just an incredible number of requests from local media to provide updates, and we just couldn't run to all the studios and still get our work done. So we decided to take questions Monday through Friday in our media center, and then the stations would come and ask me questions directly. And at some point, we, of course, had to implement preventive measures to reduce and slow transmission. And it's just crazy to me that we've been doing this for a year. So on with just a little bit of news. This also came big news for Friday the 12th. Today, Governor Kay Ivey and Dr. Scott Harris with the State Health Department announced that starting March 22nd, ADPH will extend eligibility for COVID vaccinations to include people aged 55 and older, people with intellectual and developmental disabilities, and population defined as 1C in the state plan. And 1C includes transportation and logistics, waste and wastewater, food service, including restaurant staff, shelters and housing, so, construction projects, people who work in the construction industry, finance industry, including bank tellers, information technology and communication, energy, legal, media, and public safety, like engineers and architects for bridges and, construction highways and buildings and that sort of thing. So opening eligibility to these people on the 22nd of March will add over 2 million people to the eligibility criteria in the state of Alabama. And right now, we're still only receiving in Alabama between 100 and 100,000 doses of vaccine each week. So I'm personally very happy to see the state opening eligibility. There are a lot of people who have underlying health conditions that are in those younger categories. If they're 55 and older, they now qualify. If they have intellectual and developmental disabilities, they also qualify. And then in addition, I didn't mention this, but people of any age above 16. So if you are 16 and older and you have a high-risk medical condition, you will also be eligible to receive your vaccine. So these are things like cancer and kidney disease and COPD, heart conditions, organ transplant, obesity, pregnancy, sickle cell disease, smoking, type 1 and type 2 diabetes, or other medical conditions determined by your medical provider. So as you can imagine, it's going to be a challenge to sort of, document these things. We haven't quite worked through that yet, but we will let you know. Again, it starts a week from Monday, not next week. And that first week, there are going to be some federal efforts to get vaccine in some of the rural counties with that extended eligibility. And then during the week of March 29th through April 2nd, there's going to be an additional sort of a 1 week push to get, I think, about 20,000 doses out in the 8 districts, as was done the week of February 8th. So again, just trying to push as much vaccine as we can to try to get people vaccinated. So the new criteria does not start until March 22nd. The Mobile County Health Department will fall in line with the state health department and wait until March 22nd to begin vaccinating this extended eligibility for COVID-19. And stay tuned, because we've got something really exciting for people who live in South Mobile. We have a tentative date for a large drive-through event in South Mobile, and when we get the date finalized, we will let you know as soon as we can, hopefully on Monday. So that's it for me. Since today marks the 1-year anniversary of the first case of COVID-19 reported in Alabama, you're going to hear from our health officer, Dr. Bert Eichhold, and then also Dr. Scott Chavers, who's going to talk to you about the hope that comes with COVID vaccination. All right, have a good weekend, everyone, and here comes Dr. Eichhold.
Thank you very much, Dr. Murphy. It's been a very long and hard year. To think that 1 year ago, which was the first case was March 19th, as Dr. Murphy said, in Mobile County, that we didn't know anything about this disease. It was a brand new disease to the medical industry. We didn't have adequate personal protective equipment. We didn't have adequate testing supplies. We didn't have enough testing opportunities to even diagnose this disease. We didn't have enough medical equipment in the hospitals. We didn't really know how to treat this disease. We really, obviously, at times, barely were able to have enough medical capacity. As she pointed out today, we're less than 50 persons in the hospital with COVID-19. Our high point was 256. Extremely challenging for the human resource component, both to do all the essential functions we've had to do in our community, our city, county, courts, the hospitals, your public health agency, and providing care and continuing to do the support services that are needed to keep this country and this community going have been amazing. I really need to thank our community partners, being the City of Mobile, the Mobile County Commission, for participating in the Unified Command, helping vaccinate people, helping making physical facilities available for the purpose of vaccination. Our public broadcasters and media outlets for getting good factual information to people so they could make good and healthy decisions. Then right now, we're at a point where we're on a decline in community transmission, And what I really need to stress to the community is please be cautious. Do not celebrate at this time. Our goal is to have 70 to 80% of the community vaccinated. We're at about 20% of the community being vaccinated. 70, 80% is time to relax and say we have got this thing under control and community transmission is not going to recur. In the previous pandemic, the second wave was very significant. We need to just wait and be patient another 6 or 8 weeks as we go forward. I commend the governor for encouraging us to all change our behavior to have be safe, and let's get vaccinated so this summer can be the most fun summer that we've had. There are new guidelines on what you can do if everybody in your family or people you associated have been fully vaccinated. And that is on the CDC guidelines, but that's that you've had your 2 shots if it's the 2 vaccine, Moderna or Pfizer, and it's 14 days since your second dose, you're fully vaccinated, or 14 days after you receive the Johnson & Johnson single-dose vaccine, you're fully vaccinated. It's not time to congregate in large public settings. That's going to be when we have more people, 70% of the population vaccinated is going to be the time for those large gatherings as we used to go. The loss of life is very real. It's taken the lives of some of my friends, and for that is tremendously sad. 2 people per day have died on an average in Mobile County since this started. That's 2 too many. So again, thank you everyone for what your hard work and now getting us where we've got decreased community transmission. Please don't let your guard down. Please get vaccinated when you have an opportunity. Be patient with the vaccine supply system. As you know, there are going to be a lot of people eligible to be vaccinated, but we still are going to have challenges with the distribution and supply of the vaccine. And the last that I want to do is, again, sincerely thank all the government leaders. The laws that we've used to help control this disease were established early in the 1900s, and probably the legislators who are the survivors of the 1918 pandemic put the power and authority in public health to do what we've done. We have had some challenges. There's some things we can do differently, but the system has generally worked. It's been hard. The economic stress has been tremendous. It has impacted businesses, churches, social life, and travel. But we are a strong country. We're a strong community. We will resolve and be a healthier and better community in the near future. Thank you very much. Dr. Shavers will then give you a little bit more information about vaccine.
Hey everyone, I'm Dr. Scott Shavers. I'm an epidemiologist and I head COVID-19 response for Mobile County Health Department. So you've heard Dr. Rendy and Dr. Eichel talk about where we've been and the promise of where we're going. And for me, the promise started back in December. So from the very beginning, a year ago, everything that has happened has been novel. This was a novel coronavirus. The responses were brand new. They were novel. We were dealing with things that we had never seen before. And so everything including the vaccines in December was novel. These were 2 novel vaccines that had been in development for several years, but ended up having an opportunity to be directed against the virus that causes COVID-19. So when that occurred, many of us started to see a light at the end of the tunnel, and that light's getting bigger. With Johnson & Johnson's vaccine, we now have another weapon in the armamentarium that can be taken anywhere. And access to vaccines around J&J, because it doesn't have to be kept as cold and it's a single dose, really expands availability. So my message to everyone is, please, if you have an opportunity to be vaccinated, and starting March 22nd, the eligibility dramatically increases. In fact, it more than doubles individuals that are eligible for these 3 vaccines. If you get a chance to have Moderna or Pfizer, please take them. Johnson & Johnson's an incredible vaccine, but it's going to be a little bit before we see a lot of the vaccines available from them. So what's also very encouraging is the vaccines that we have are effective against these new variants that you're hearing about. So as Dr. Eichel talked about, if we look at 1918 influenza pandemic, it came through in 3 waves, and those waves were defined by changes in the virus. What I really want to do is encourage you that until you're fully vaccinated, as Dr. Eichel said, please keep doing what you're doing. Please wear your mask, socially distance. Please do not put us in another spike before we can get more individuals further along the line to herd immunity, which is our goal. So in Mobile County, that's 300,000 people, roughly. So we're about 20% in the state of Alabama toward that goal. In some populations, we're ahead of that because of the eligibility. Some we are below that. But as eligibility increases, we're going to have that opportunity. The other good news I want to share with you is that vaccine supply, while right now is still critically low, it's expanding. So a lot of the manufacturing issues that Pfizer and Moderna had early on have been addressed. So we're starting to see more, and we will see more J&J vaccines as we go. So hold tight, keep doing what you're doing, keep the numbers low, and then we will get through this. So thank you all very much. We'll be back on Monday with our expanded report, and we really do wish you a great weekend.